Hi, my name is Abida Dhukai. I'm a nurse practitioner on the platform Science and Humans. And it's my pleasure to introduce Dr. Adeel Khan, who is a physician specializing in regenerative medicine. Welcome. Thank you for being here today.
Yeah, I'm excited. Thanks for having me.
Thank you. So I know you're very passionate about stem cells and gene therapy. Can you tell me more about it and what it involves and what excites you about it?
Yeah, I mean, it's such a broad field. The thing I'm most excited about is the opportunity to treat aging and to treat chronic disease, because the biggest problem right now in society is not acute illnesses, it's acute exacerbations of chronic diseases. So what that means really is, imagine you have heart disease, diabetes, or COPD, like lung disease, all these different chronic diseases that people live with day to day. There's no actual treatment of the root cause. So what the medical system we have is essentially managing the symptoms, and then eventually people get exacerbations, meaning their symptoms worsen, and then they end up in the hospital with COPD exacerbation. They can't breathe, and then they have to go on medications. Or you used to work at the hospital, right? So you're probably very familiar with this. It's a revolving door.
Yes, it is.
And so there's no real root cause treatment. And regenerative medicine has this promise from like 30 years ago when it was first really coined of repairing or reversing disease. Now, you're probably wondering, what happened in the last 30 years is that there's a lot of research to get to this point where we can actually use these therapies now to do it reliably. The problem was there was a lot of excitement in regenerative medicine a long time ago, but it didn't really pan out, because it turns out when you try to use these therapies, it's different in a test tube or in a petri dish than it is when you put it in human bodies. It doesn't always translate the way you think it would, or even in animal studies, like from rat to humans. But now it's getting to a point where we're able to kind of engineer these therapies to make them more customized and to make them work a lot more effectively. So that's why it's exciting, because obviously there's a huge aging population, there's way more people with chronic diseases, and it's putting huge burden on our medical system. So there has to be a solution that actually reverses these problems, or cure, I never like to say cure, but remission, right? Like you're putting chronic diseases into remission. And this is already being seen. Like you can see it with type 2 diabetes, which China actually just put, it was on the headlines kind of all over, which was that China published a study showing that they use stem cell treatments to cure people of type 2 diabetes. And India has also done trials on this. There's also been trials done in Canada for this with type 1 diabetes. So we're just on the verge of all these chronic diseases getting actually cured or reversed with these cellular therapies and regenerative medicine. So it's kind of an exciting new era we're entering.
Yeah. And so do you recommend starting these therapies when people are younger as a preventative measure, or do you feel like, if they've had these diseases that they can take them, people who are in their 60s and 70s? Is that something that would be beneficial?
I mean, I'm not that old. Actually, I'm 55. No, it's just all the stem cells. That's why, yeah. So it's one of those things that you can start really, the younger, there's a saying in medicine, right? An ounce of prevention is worth a pound of cure. So why not try to prevent? You can't prevent aging, but you can slow it down significantly, and you can also prevent age-associated chronic diseases. Because as you get older, there's more autoimmune conditions, there's more cancer, there's more stroke, there's all these dementia, all these diseases that increase as you get older.
Yeah.
And if we can slow down the aging process, then obviously you can delay all those chronic diseases. And that's why aging is such a hot topic and exciting. And there's nothing better in the world at the moment than regenerative medicine to treat aging, as shown by the research, and obviously we see it in the real world as well.
Exosomes and peptides have been gaining a lot of traction right now in media and regenerative medicine. Can you explain what they are and how they work?
There are two kind of huge topics. So I think first, to understand exosomes, you have to understand stem cells, because exosomes are derived from stem cells. So what is a stem cell, right? It's basically a cell in your body that can turn into different types of tissue, and it can also repair or regenerate tissue. This is basically two functions: self-renewal and differentiation into specialized tissue. Those are the medical terms, but essentially there are little cells in your body that are able to fix things, or they're able to turn into new types of tissue in order to fix things. So they're really cool cells, and when they replicate and grow, they have this soup that they grow in, and that soup is the exosomes. So the analogy I like to always say is, imagine you have chicken soup, and the meat is the stem cells, and then the broth is the exosomes. So basically you're taking the broth, which has what are called cytokines and microRNAs, which are little signals that can reduce inflammation, that can help regenerate, repair tissue, and that have all these amazing effects on the cells and have no actual cells themselves. They're just signals. So the positive aspect of that is because it's a signal, it doesn't have any real risk with it because there's no cells in there. Because stem cells inherently, because they're cellular therapies, have a bit more risk with them, which we can talk about, but exosomes, because there's no cells, they're just like a signal that stays there for minutes to hours, they're super safe. And that's why they're getting a ton of attention. Now, the drawback of that is that because there are no cells in there, the signals only stay there for minutes to hours. So the dosing may have to be repeated several times to see the benefits. So for example, if you're doing a facial treatment or for your hair or IV, which are like the common applications, you may need multiple treatments to see really good results. So that's the only, I would say, downside of the exosomes compared to stem cells. But they're super safe and they're now becoming widely available and accessible. I feel like every clinic is offering them now, just because of the cosmetic industry, obviously. But I would say the biggest thing is the quality of exosomes too, right? Where are they coming from? And how do you determine if one quality is better than the other? The way is you have to look at what's called a cytokine analysis, which is basically what's the profile of growth factors and anti-inflammatory signals, and then comparing them to other products. So if you're trying to get exosomes done from somewhere, just ask them like some basic questions. And if they can't answer them, then that's probably just because they don't really know what they're doing, and they're just trying to offer something as a kind of a money grab, more or less. Because there is a lot of that in this field, because regenerative medicine is such a hot topic, and so many people are looking for these things. So that's one way to kind of discern whether or not the exosomes you're getting are actually going to be high quality, is by asking them about their manufacturing, sourcing, and kind of like third-party analysis to see the profile. So then peptides. That's a big topic. Obviously, I think a lot of people have heard about them, like the most common being Ozempic or semaglutide. And then there's second generation Ozempic, like tirzepatide. Now there's even third generation Ozempic called retatrutide. And so that one is coming out now too. And these are just improving in terms of their ability to not only lose weight, but improve your cellular health. And that's why I like peptides. Because if you think about it, peptides are basically modifying signaling pathways, and they're modifying your cell's ability to do their job. So, for example, most people have heard about Ozempic, and Ozempic, what does it do? It increases GLP-1, which is basically saying, hey, I'm going to get more full now, and I'm probably going to feel a bit nauseous while I'm at it, but people eat less. But the problem with that is that it's not actually improving your cellular health. The idea is we want people to start thinking about whatever intervention you're doing, start thinking about what does it do to my cells. So Ozempic, unfortunately, is all it's doing is making you more full, so it's not actually improving your cells, right? But tirzepatide, or what's the brand name again? Wegovy. Wegovy is a brand name, I think. Mounjaro. Mounjaro is the second generation version, and that not only makes you fuller, it improves insulin sensitivity. So it's actually making your cells healthier at processing sugar, because it's making your cells more sensitive to the signal of insulin. And so your body can, instead of it floating around the blood, it goes into the cell, and your bodies can use it as it's supposed to, right? And that's what happens, obviously, with diabetes and with even metabolic dysfunction in general, which is so common, is that people's cells start becoming resistant to that signal of insulin. And the third generation has that insulin component, and then it also has glucagon component, meaning that allows your body to mobilize the sugar and use it better too. So it has another action. So basically, these peptides are becoming more sophisticated, and they're actually synthesizing new peptides, I feel like every few months now. There's so many peptides coming out. And so now we've gone from having like 10 peptides to probably over 100 peptides. And then sort of it's almost overwhelming unless you have to become almost like a peptide expert. And luckily I have people on my team, that's their full-time job. That's all they do is peptides, who I converse with, and I'm able to keep up with the science that way.
So a lot of our patients come to us and asking about peptides, and there's certain amounts of peptides that are available in Canada. Which ones do you like? And based on the lack of availability in Canada, what would you recommend?
I think the ones that are most common and the most popular, as we talked about, the weight loss ones, obviously, but then the other ones that are becoming very popular, there's one called BPC 157, which is body protection complex, or the Wolverine peptide. A lot of people have heard about that because basically it helps with healing and regeneration, and it's super safe, and it's been studied extensively in animal models. There's not large randomized human trials, but there's probably millions of people who've done it at this point. You know what I mean?
Yeah.
And that counts for something, real world evidence, real world experience. And the other thing is super safe. So there's no real downside to it. And there's such a high limit before you can like overdose on it or cause any sort of harm, that it's one of those things that's a low hanging fruit for a lot of people who may have chronic injuries or have gut issues, because it can help with gut healing. And it's just an easy thing to be prescribed or try it. But again, these things should be monitored by a physician or a health practitioner. It's not something you should just order online and just do yourself, because there's reasons why these things there's still that kind of controversy around it, because that direct-to-consumer model in the US really took off. But then the problem with that is there are sometimes side effects, or there are things where people just go super high dose.
Yeah.
And then because they don't have a physician or a health practitioner who's monitoring them, telling them, hey, this is like the right dosing, you need to cycle off of it. These are things we have to monitor for. Just like with any time you prescribe something, there's nothing in the world that you can prescribe that's without some sort of risk.
Yep, absolutely.
So the other big one is TB4 or TB500. Again, it's thymosin beta 4. Thymosin it works on the thymus gland. Your thymus gland is this little organ that sits around your sternum, and it's really important for your immune system, so that it helps you reduce inflammation by acting on your thymus gland. And what that does is, by reducing inflammation, you create a microenvironment that allows your body's cells to heal better. So thymosin beta 4, TB4, and BPC 157 are probably the two most common people use for healing, anti-aging, regeneration, just general aches and pains, aging, because they have a lot of different benefits. And then the other big one that's becoming super popular are the growth hormone peptides.
Yes.
Now, because of Science and Humans, you guys prescribe growth hormone, right?
Yes, we do.
But the issue with prescribing growth hormone is, at the end of the day, you're giving your body an exogenous hormone, so you're shutting down your own production to a certain extent.
Yeah.
So why not try to get your own body to just produce more growth hormone? That's what the peptide is, right? It's a signal to your pituitary to say, hey, let's make more growth hormone.
Yes.
And now there's kind of different versions of that too. So the mix I like, there's one called tesamorelin, which is like a third generation peptide, growth hormone peptide, that's actually got FDA approval at one point for visceral fat, which is, visceral fat's a really bad thing, right? That's an inflammatory fat that builds around your organs. So this is great for fat loss, but importantly, it's important for, it also helps with recovery, aging, and again, it's one of those things that can be cycled throughout the year. So I think those are probably the top three, I would say, that are most popular, probably most well used.
Yes.
And then there's like, dozens of other peptides we could talk about, but I would say those are top three.
Oh, great. And so going back to Ozempic and the GLP-1s, when we prescribe them, we always advise individuals, hey, listen, you need to do resistance training, and you need to eat well and exercise. And so there was that concern that it can reduce muscle mass. How would you recommend people go about counteracting the effects of the GLP-1s and the reduction of muscle mass?
Yeah, no, what you said is exactly 100% right on, which is people just need to do resistance training. If you're taking a GLP-1 and you're just doing yoga and walking, then that's actually going to be risky, because you will potentially lose muscle.
Yeah.
And so doing resistance training will significantly decrease the risk of that. And then having enough amino acids and protein is another simple way to do it. So it's not like it's hard. You just need to educate the patient. And like you said, and that's why it's important to have a health practitioner to kind of oversee your care while you're on the peptide, to make sure you're minimizing any risk. And I think the data is a little bit mixed from the scientific. Some studies suggest that, hey, maybe it actually helps with retaining muscle. Maybe you won't lose muscle on it either. And then other studies suggest maybe you will lose some muscle. So I think the data is a bit mixed. And that's why, if the data is mixed, just take the more conservative approach, which is, let's just assume that it is going to cause fat and muscle loss. So let's do whatever we can to protect your muscle. And that's resistance training, and 1 gram per pound of body weight protein intake would be my other recommendation.
And that's also for women, because
Yes.
women shy away from like, oh, I don't want to consume so much protein. I need to sort of reduce my carb
Yeah, that's like a
intake.
myth that needs to die.
Yeah.
So like from the 1980s. It's really hard to overdo it on protein.
Yeah.
And plus, if you're a woman, it's so hard to put on muscle as it is, just because your body doesn't have as much testosterone.
Yeah.
So you're not gonna get muscular and big unless you're like a genetic freak.
Yeah, absolutely.
Yeah.
And so going back to muscles and thinking about other ways to improve that and helping reduce inflammation, we do offer testosterone and we offer bioidentical hormone replacement on Science and Humans. And it's something that we've sort of, I feel like we've excelled in terms of helping men and now women, realize the importance of testosterone. So
Yeah.
how do you see testosterone as an anti-inflammatory, or how it works
Well, I
in
think
the
it
body?
works so synergistically with the peptides, for example, because say if you're a male, you have 50 pounds to lose, and in modern environments, so to speak, there's so many reasons why people have low testosterone. Just honestly, there's something called endocrine disruptors, microplastics, there's all these toxins now in the environment. Plus, if you're overweight, your body tends to convert more of the testosterone to estrogen too, because of fat. That's just what happens. And so you have all these factors driving men to have low testosterone. And by optimizing it, you're going to increase their energy, you're going to increase libido, but you're also going to increase the resistance to losing muscle. And then obviously when they have more energy, they can probably train better too, and then they can put on muscle. So it's going to work very well with something like a GLP-1, because then, hey, all of a sudden you're working out and you're doing something to help your body to lose fat at the same time. So I think that combination, and same thing with women, right? When your hormones are dysregulated and off balance, like good luck telling a woman who's like, it's like, it almost, that's what bothers me about the fitness industry a lot, is that they're telling these women who have all these hormonal issues, oh yeah, you just need to train harder and you need to eat less and all this other stuff. But it's like, no, actually their hormone systems are all messed up. First you have to fix that. For a lot of women, that's actually a really big problem, or or they have metabolic issues. Because I'm sure you're using it too. There's so many women who don't eat much and but they just can't lose weight. And why is that, right? There's other factors. It's not just simple as just saying, oh yeah, you just your calories. And that just, all that does is make people just feel worse about themselves.
What role do you think muscles play in longevity? And if you would have the ability to craft a plan that includes diet and exercise and supplements and hormone optimization, what would that look like?
Yeah, no, so there's a whole program, I guess. So it's interesting because I'm actually working with Enhanced Games right now. And one of the things I get to do with Enhanced Games is I get to make mutant athletes, meaning I get to design whatever I want, because these are going to be Olympic Games where we can use anabolic steroids and we can use whatever we want, and peptides included, because peptides are banned by WADA, right? And so, which is silly, and they're banned by like a lot of sports regulatory bodies, even though they're not enhancing sports performance, like we just talked about, they're enhancing recovery. So that's why a lot of people are realizing the Olympics are kind of silly, because it's the institutions that control them and all this other stuff that's changing the narrative around what's actually possible for an athlete. So if I could design a program for optimal muscle and longevity, it would obviously include peptides as part of that. But the reason I bring that up is if you're a pro athlete, you're technically not allowed to use peptides. So that's a silly thing. But essentially the foundation of any program has to be based around lifestyle, which means sleep, stress, making sure you're getting enough protein, and sense of community, purpose, like all the basic stuff. Because at the end of the day, if you don't have that stuff, then it's going to be hard to be able to actually do the resistance training and the programming if you're only sleeping like 5 hours a night and you're stressed all the time and you're like, it's going to be difficult to do that stuff. But as my friend Gabrielle Lyon, who she always says, muscle is an organ of longevity, which I totally agree with. She coined that term, which I love, because essentially you have all these different organ systems, but people don't realize muscle is a complex organ system. What does that mean? It means that it sends signals throughout their body. So there's something called myokines, which are released. Myokines, just like similar to cytokines we talked about with exosomes, myokine is a signal that goes to your brain, that goes to your cells. It turns off genes that can cause cancer, tumor suppressor genes. It can help with reducing inflammation systemically in the body. It can help with helping to increase insulin sensitivity, so make your cells more sensitive. So it has all these amazing metabolic effects. And there's another thing too that we learned recently, I learned this while I was in Japan, is that what exercise also does, it increases your circulating stem cells. And there's these special stem cells in your bodies called mu stem cells, M-U-S-E, and they were discovered in Japan, but they're like these super soldier stem cells in our body that float around. And the people who exercise regularly have more of them. So it's like you have more of the soldiers to repair your body if something goes wrong. And that's only for people who exercise regularly.
Yeah.
So you have more regenerative capacity and resiliency and tolerance to stress if you exercise. So there's all these amazing cellular benefits that happen only if you do that stuff. And so that's why if for someone who's just starting out, the most basic thing is honestly just doing 2 to 3 times a week a full body routine, meaning doing like a full body training session, not like a lot of people, for whatever reason, I mean, it's the body, again, it's the bodybuilding influence from the 1980s. It's still pervasive, which is a lot of people think one day they have to train arms, one day they do chest, one day they do legs, but that's actually not the optimal way to train. High frequency training works a lot better. So meaning repeating the same training over and over again. So doing like a full body, if you're a beginner, which most people are, because they just are, like they're not at an intermediate stage where they've been training for many years and they have a good amount of muscle on. So most people are beginners and they just need to do a full body routine twice a week and then start, my biggest thing is getting a coach eventually too, because you have to do periodization, which means your body's smart, right? Your body will, if you keep doing exercise, your body will adapt.
Yes.
And then it adapts and the same response will no longer have the same benefit anymore. It's called hormesis. It's just how your body works. And so you can't just do the same routine over and over. You have to do periodization, which is where it makes it tricky because it's like, okay, how do I periodize? Well, periodization is a science, and it's a very complex science where people have PhDs in this stuff. So you can learn it yourself and try to figure it out, or you can just hire a coach. I used to be a personal trainer, and I've obviously done this stuff for long enough, so I can periodize my own programming. But for a lot of people, they actually need a coach to tell them, okay, after 6 weeks, this is what you need to change. These are the variables you need to change, and these are the adjustments we're gonna make. And there's so many online coaching now, and like it's super accessible. So I don't think there's a reason not to get a coach if you can afford it.
And what about supplements? What supplements do you like that you think are really beneficial to both men and women?
Yeah, no, I think for men and women, and this is going to be the most important supplement for sure, is going to be creatine or CreaPure. CreaPure specifically is a German brand. And the reason is because a lot of the creatine that's from China is not the best quality. So CreaPure, if you just look for that specifically, which most companies, high quality companies will use, then that's the best type. And creatine in general has over 500 studies. And why is it so good for you? Because it comes back to the mitochondria. So if you go back to high school biology, people remember the mitochondria is like the energy powerhouses, but they're a lot more than that. And there's a huge science on mitochondria right now. So just think of them as the most important regulator of cell metabolism. So meaning your cells are always producing energy, right? Like even when you're sleeping at nighttime, your cells are always working. Your cells are always working hard for you. And so the mitochondria are the ones that take the amino acids from protein or fat or sugar, whatever, to metabolize and make energy, right? And then, but over time, your mitochondria become dysfunctional, and as you get older, their ability to do that becomes less and less, or because of hormonal issues, or because of chronic diseases, or whatever it may be, the mitochondria may not work as efficiently. And creatine is an easy way, like a very easy way for your mitochondria to just support the function of it, because that's what it does. So that would be my definitely number one favorite supplement for that. And then on that note, there's also one called urolithin A, which is also another mitochondrial support supplement I think a lot of people could benefit from. And then there's kind of the basic stuff like omega-3 fish oil, vitamin D3, magnesium, I would say is the second most common micronutrient deficiency. But the problem is our soil is so depleted now of nutrients. So meaning even if you're eating, if you're eating like spinach or kale or even an apple, like they've done studies on this where because the soil's so depleted for like vegetables, but even for fruits, just the way they're grown and farmed, they don't have the same nutrient density that they used to. And so I think almost unless you eat a lot of organ meat, which is very nutrient dense, and I don't like organ meat because it doesn't taste that great, but yeah, it's acquired taste. And so for people who don't eat a lot of organ meat, pretty much everyone needs to take a multivitamin, and a high quality one, not like a Centrum or a Costco one. And that's the problem with this whole supplement industry is the lack of regulation. And so you have like 99% that's just essentially garbage, and then you have 1% that are gems. And so you have to know how to figure that out. And so I try to make recommendations that we have online, like on our website and online that are good trusted brands. Yeah.
Poor hormone health is linked to chronic conditions such as cardiovascular disease, osteoporosis. There's some evidence that shows that lower testosterone levels increase the risk of dementia in men, as well as women having low estrogen levels. So how do you think you can best optimize your health through hormone replacement therapy?
Yeah, I mean, I think people need to understand two things about the data around hormone health. So first is obviously the clinical evidence, meaning what's like the clinical trials out there and everything. And for men, there's actually a good amount of evidence suggesting that men who have lower levels of testosterone, like we're talking like lower bottom percentile, but even like low side of normal, you know what I mean? Not so being optimal means being like upper 2/3. So anything below that can actually increase your risk of morbidity and mortality. Like you said, morbidity, chronic diseases, mortality meaning dying earlier. And if you think about it, let's just say you take a very like evidence-based medicine approach where like, oh, there's not that many randomized control trials. It's like, okay, well, let's think about it from a first principles perspective, which means what's the root cause as to why you age in the first place, right? And like we talked about, it's because you lose muscle, you don't have enough energy, you start getting aches and pains, all this other stuff, you start putting on fat, and then you start getting metabolic dysfunction, and your mitochondria start becoming dysfunctional, essentially. That's actually called the unitary theory of aging, which is that we think the reason our bodies get older is because the mitochondria aren't working the way they should be. And that's one of the biggest drivers of aging, if not the most important. And so if you put on more testosterone, or you put on more estrogen, then hey, all of a sudden you have more energy, you can put on more muscle, you often your sleep improves, and all these other things that are indirectly going to improve your lifestyle and allow you to do the stuff that we know 100% for sure increases your longevity, like working out and just putting on muscle. So that's why I think this stuff is so important, because at the end of the day, it's going to allow you to live a healthier lifestyle longer.
Yeah, absolutely. And a lot of guys, when they come to us initially complaining of fatigue and low energy and inability to lose weight, despite some of these guys are exercising like mad. And you check them and their testosterone levels are low, and then you sort of come up with a treatment plan, and then, you know, we see them 3 months later and they feel great. They're energized.
Yeah, and for men, one of the interesting things is the most common reason for like a Prozac prescription, like antidepressant prescription, is actually low testosterone.
Yeah.
So a lot of doctors don't actually check, because say if you go to your family doctor, you're like, oh, I'm like, you know, I feel depressed, I'm tired all the time. Doctors don't routinely always check for testosterone.
No.
It's still not pervasive. Like it's, people think that it's like something your doctor will do routinely, but no. So you have to, and that's obviously why Science and Humans exists and these companies, because unfortunately it's still a relatively unmet medical need in the mainstream community.
So how would you think, so going back, so a lot of family doctors don't have time to dig deep, right? They've got lots of patients and very few, you know, opportunities to sort of dig deeply in with their patients. So what would you say people should do to advocate for themselves in terms of their health?
Yeah, I mean, it's tricky because, you know, I feel like as a doctor, it can be annoying when a patient comes and be like, I want this blood work, which is people do all the time.
Yeah.
I personally don't find it annoying, and I think I listen to my patients and I'm okay with that, but but other doctors may get a little offended, be like, oh, I'm the doctor and I know what I'm doing. So it can be a fine line, and I think the best way to approach it is to say, hey, I've been doing some reading, and I've been listening to some experts, not just like, you know, random people online, but there's so many experts who are the best in the world at what they do, who are talking on podcasts and online. And so you can't just discount them because it's from YouTube or something. It's not about it's about who is a person and their credentials. And a lot of them are very well versed in their field, obviously. And so I think if you're a patient, you just say, hey, I've been doing some research, I've been reading, what do you think about this? And that way you keep it a conversation as opposed to saying, I want this. And then hopefully your doctor will be able to engage with you. And if your doctor gets offended or just thinks like they know everything, then you probably should find a different doctor. So that's the truth of it. Yeah.
Do you think treatments aimed at optimizing hormone levels, such as hormone replacement or peptide therapy, reduce systemic infection and contribute to healthy aging?
Yes. So they can definitely reduce systemic inflammation because, I mean, the way they do it, there's two mechanisms. One is directly and indirectly. So indirectly, obviously, because like we talked about, if you live a better lifestyle, then that's going to reduce systemic inflammation. But directly too, these hormones have effects on the gene expression and affecting the cellular pathways that regulate inflammation. And we know that the biggest driver of why your body gets chronic inflammation in the first place is because your immune system starts to become dysregulated as you become older. So your immune system, if it has like three main kind of compartments. One is the bone marrow, where the cells are made, the immune cells are made. The other is the thymus gland. The thymus gland is where your T cells, which are part of your adaptive immune system, become educated. So I always say it's like the school system for your T cells to learn what their job is going to be when they're older. And then there's something called T regulatory cells, which regulate your immune system, which are super important for preventing autoimmune disease and preventing systemic inflammation. And then the other one's your gut. Your gut is where 70% of your immune system is kind of because of the gut bacteria and how they make immune cells and how they regulate them. So it's your bone marrow, your gut, and your thymus gland. And so when you optimize your hormone, you're basically creating a favorable environment for all these things to work better. And so that's why they have these indirect and direct benefits of keeping your immune system from becoming dysregulated. And as you get older, this dysregulation increases, and hormones are one very easy, low-hanging fruit way to prevent that.
And as you get older, the hormone therapy, does that have to change? Is it changing in terms of reducing the amount you get, or are you increasing it, or are you keeping it the same as it was when you first started? So for instance, some gentlemen come to us and they're 45 years old, and we know that it's safe to be on these treatments for lifelong. But in the sort of, once they hit their 70s and 80s, do you see that they have to change their regimen? Do they need to add additional therapies to help with longevity and health, or is them staying at the same?
Yeah, I mean, I think there's a lot of individualization, and things can change, especially as you get older, because the hormonal system becomes less functional, obviously, because, for example, your thymus gland becomes atrophic. It shrinks as you become older and older. So it's not doing its job as effectively, which means more dysregulation of the immune system, which means more chronic inflammation, and that can come back and affect your hormone synthesis as well, right? Because when you have more chronic inflammation, that affects your general organ function. And so your body can't synthesize the hormones like it used to, and so you may have to increase the dose. And that's, again, comes back to monitoring and having regular blood work, but also having someone who's sophisticated enough to know that, hey, like, this is how often we need to check it, and in the future you may need to change things. And for women, it's even more complicated because there's progesterone, there's estrogen, and there's sometimes even testosterone in women, DHEA and other things, right? So it can be a bit more tricky for them too, and things may change as they go through menopause, for example.
So if you can explain further detail about what bioregulators are.
Yeah, so bioregulators were actually started in Russia in the 70s because there was submarines that had nuclear submarines, basically, and these people who were going down there were getting cancer and getting all these illnesses, and so the Russian government was like, to their scientists, they're like, we need something to offset this. They're aging faster, they're getting cancer, and so they come up with these bioregulators, which basically are like peptides, so meaning a short chain of amino acids or a protein essentially that works on specific organs. And what that does is it increases the function of organs. For example, there's bioregulators for your kidney, for your liver, for your heart, for your blood vessels, for your brain, for everything basically. There's like 20 different types.
Yeah.
And for obviously there's bioregulators for the hormonal system, like pineal gland and adrenals and ovary and thyroid. And these can work synergistically with HRT or hormone replacement therapy because you're not just replacing the hormones, you're actually trying to get the organ to work better. So you're upregulating the function of it, which means if it works better, then maybe you won't need as high of a dose of the hormones. Or maybe you're kind of in that in-between zone where you're like, I'm not sure if I want to start HRT or not. So maybe you can do a course of bioregulators for 3 to 6 months and then reassess and see if that fixed the problem. And it's such a low-hanging fruit that, again, has been around for 50 years in Russia, and now we're just starting to find out about it in Canada and US.
So do you see it coming to Canada and US?
Yes, it's starting to already. There's a few companies that are offering it, and for now it's going to be regulated. It's basically like a supplement, so it should be something that becomes more accessible, and it's one of those things we want to offer as Science and Humans, and we will be offering in the next 6 months or so.
Speaking of peptides, can you explain exactly what they are?
Yeah, so the first peptide was insulin, actually, and it was made over 100 years ago. And what a peptide is, it's basically a signal to your body to achieve a specific task. So it's a very broad definition, but think of it like if you're ringing a doorbell at a house and that doorbell goes to one of the doors inside of the house and tells that door to open. So it basically is going to open a specific door inside of that house. And that's like the peptide. It only acts on one specific receptor or one specific pathway. And so it's essentially a short chain of amino acids, by definition, like 54 amino acid chain sequence, which just means that it's almost like a small protein. So think of it that way. And so now, because the science of understanding these different peptides and that there's so many small peptides that exist in our body that we didn't realize before, then we're able to synthesize those and make what are called bioidentical peptides, essentially, which is that our body naturally makes these, but we're just giving you that form because it either decreases as you age or because of some chronic disease state, your body's not making as much as it should. And so we're just trying to optimize or increase the levels of it, whether that's temporarily or long-term, depending on the issue.
Oh, that's really interesting. And so I think about gentlemen who come to us who say we still have aches and pains, their testosterone levels are optimized, and then we check their IGF-1s and IGF-BP3s and growth hormone levels, and everything seems to be, maximized.
Right.
And so how would you help those guys who say, I've got these lingering aches and pains, and I'm still having issues with fatigue?
Yeah, exactly. Those are the perfect candidates to do like a cycle of peptides for like 8 to 12 weeks. Usually, if it's fatigue and aches and pains, the easiest ones are BPC 157, which we talked about, TB4, and then the other one would be one called SS31, which is a mitochondrial peptide because it helps to upregulate the function of mitochondria. It works on something called cardiolipin, which is basically this protein that helps to stabilize the inner mitochondrial membrane. Your mitochondria is like this electrical conduction system where it sends, it basically turns those signals and has to generate ATP or energy. And cardiolipin is the way that stabilizes it. And so they estimate something like 15% of mitochondrial dysfunction comes from cardiolipin. And so SS31 acts on that. And SS31 is a very well-studied mitochondrial peptide. And again, it's been around, it's not new, it's been around probably for over 15 years. And so you can do SS31, BPC 157, TB4, and then you could probably add in something like tesamrelin, ipamrelin, which is a growth hormone peptides. That should help with fat loss, energy, recovery, aches and pains, and they should feel pretty awesome.
Yeah. So it's not something that they have to take for long.
No, just do a cycle of it. And then you could do it for longevity, or if they want to do it periodically, you can do like 2-3 months off and then do it again for like 2-3 months. And you can just cycle on and off as needed.
Yeah, and a lot of guys when I do prescribe them, semarelin or somatropin,
Yeah.
I usually do recommend that they cycle on and off just to give their receptors a bit of a...
Yeah, exactly. And you don't want to get pituitary burnout with the growth hormone peptides. And that's the reason, usually you cycle and then you usually do like 5 days on, 2 days off or something like that.
Yeah, absolutely. Wow, that's really great. Well, that gave us a lot of information to think about. Thank you for your time today. And where can we find more information if we want to reach out to you? How do people reach out for?
Yeah, as you can probably tell, regenerative medicine, especially peptides, is a growing science, and it's only going to grow exponentially over the next 10 years. So people can find me at DRAKHAN, AKHAN on Instagram. Pretty accessible over there, and they can message or contact my team if they have any questions.
Great. Thank you so much.
Yeah, thanks for having me.